This morning, heart disease, the major killer, one of the major killers in the U.S., might be a little help on the horizon. To talk about it is heart disease specialist Dr. Robert Edmonson joining us on the wake-up call. Doctor, good morning.
Good morning.
Great to have you on. So why don't we start with a reminder as far as where and what, heart disease, as far as, on the list of, to put it lightly, but, carnage here in the U.S., kind of remind us where it is and how impacting it is on our society.
Well, it is a major impact. It's a greater cause of death than a combination of the first five, which, includes cancer, the next five. And so it's in cardiovascular disease, heart attacks and strokes. And that's men and women. And one of the factors which is not commonly known but appreciated in some individuals, unfortunately, the first evidence of coronary disease in about 50% of people is a fatal heart attack. So you don't often have warning, and it's tragic when that happens. Often to fairly young people with families, and so it's a critical issue and very important for us to be mindful of and trying to prevent and reduce incidence of.
Talk about the what percentage is lifestyle related and what is genetic. As far as no matter how healthy you think you are, you just got it in the track record.
I believe that lifestyle far outweighs the heredity and genetic aspect of it. Certainly, there are some people that have a familial hypercholesterolemia that's extremely high, and that puts them at higher risk. But people with family histories of it generally have the same lifestyle as they promote to their children. And so I think that's a major factor. In the Asian countries where they have principally plant-based nutrition, where they have more unified families, where they do more physical labor, they basically don't have cardiovascular disease, nor do they have the incidence of cancer we have. So lifestyle, I believe, is very important for cardiovascular disease and cancer as well.
You talked about heart attacks and that there was no symptoms or anything like that. I mean, for those other people that maybe are experiencing palpitations or some things of that nature, what should people specifically be on the lookout where they're not going to put themselves in a high level of paranoia, but it is going to bring some concern to your health situation at that point?
Well, the two points I'd like to make in that regard. One of them is that when heart attacks occur, it's from a blockage which may be nearing the artery only about 40%, which is not sufficient to cause obstruction. But if the disease is very rapidly moving, a lot of what's called foam cells in it, it becomes almost like a ball that ruptures the blood vessel. That attracts a blood clot, and the blood clot closes the artery. So that's why often people don't have symptoms. Sometimes that stutters, and so you have some discomfort, feel diffuse in your chest, you feel a little bit weak and sweaty, then it goes away. Well, that clot may have dissolved, but you may have the instability there. So when that sort of thing occurs, I wouldn't pass those indigestion. I'd be checked to be sure that you're not having an unstable problem. If you have a disease that's progressive or slowly, then it causes typical angina, which means when you at rest, you don't have symptoms because there's enough blood in your heart muscle. You start exerting yourself, you get shorter breath, you get discomfort in your chest, maybe radius to your neck and your shoulders and arms. You slow down and stop, it goes away in a couple of minutes. That's very typical angina, and certainly that should promote going to see the doctor. Symptoms of a heart attack sometimes could be deceiving. It could be just severe nausea, weakness, and sweatiness without the chest pain. But diffuse substernal chest pain, high pressure to chest, particular radiation associated with weakness, these are all symptoms which should warn a person, and they should get care immediately when that sort of symptom occurs.
Let's talk about this study with the anti-inflammatory drug Canquemubab, or something to that effect. 4 years, 10,000 participants. The findings were what?
Well, the findings were that they reduced the incidence of cardiovascular disease and potentially lung cancer, but definitely cardiovascular disease significantly. And that's a critical study. One of the important factors of it was that the patients were on a statin, and the LDL cholesterol levels were not affected by it. So that just reinforces what we know, and that is that 50% of people with heart attacks don't have a high LDL, at least by what's considered to be the high LDL standard, which may not be low enough. But there's other factors involved. Statin drugs are important. They reduce incidence of disease by about 50%, but that leaves 50%. And inflammation is really the factor that's responsible for most of the events. This is the first study that's actually proven that reduced inflammation reduces events, but we've known that inflammation is a major factor for a long time. This helps us solidify that more. It's going to promote more research, but I think also it should intensify physicians and to talk to their patients about the factors they can do to reduce inflammation in the body independent of drugs, which is lifestyle. Obesity, lack of exercise, tobacco, stress, all these things increase inflammation in our body, and the reverse of those reduces it. So there's a lot that we can do ourselves to reduce our chance of having problems. That's what I mentioned that happened in those Asian countries. Their lifestyle does not produce inflammation in their bodies. So that's a major factor. And I will also say that the same risk factors related to heart disease relate to cancer. Cancer probably ties into this same issue. So I think the implications of this are very important, and I think that it's really understressed in our general practice, and people don't have the sufficient awareness of it.
What would be, doctor, a risk factor or something, why somebody would not want to take it? Is there anything that any drawbacks that comes with a drug like this?
Well, this one, yes, it reduced immune response. And so the person didn't have the immune ability that they normally have. They couldn't fight infection as well. And there actually was some increased risk of death with infection due to lack of immune reaction. But the factors which I talked about all improve our immune system, which is probably one of the ways in which it helps reduce cancer. So, yes, there was a drawback to it in that regard, and there'll be more research about medication and drugs that would reduce inflammation, and we're all looking for that. But what we should do is take our health into our own hands and look at the fact that all these lifestyle changes we could do are a gift to ourselves to make ourselves healthy rather than denying ourselves of the leisure or the foods that we like to have. So I keep going back to the same thing, but I really believe it's the fact that we need to take this information and translate it into our everyday lives.
Great way to leave it. Thank you, Doctor. Dr. Robert Edmonson, who is a heart specialist. Appreciate all the good advice.
Yes, sir.
A recent study suggesting that there's an anti-inflammatory drug now that could significantly reduce risk for heart attack. Heart disease specialist, practicing cardiovascular disease doctor, Dr. Robert Edmonson, in the great city of Dallas in the great state of Texas. You're not affected by Harvey where you are, Robert?
No, not in Dallas, but it's sure tragic in other parts of our state.
Now, okay, tell me about this Kinumab. How do you pronounce that?
Well, I think I'll leave that up to you.
There's a drug that can help significantly reduce the risk of heart attack. Okay, so do you suggest we take this drug?
Well, I can tell you about it, although it's very difficult to pronounce. And it's this study that showed it reduced cardiovascular events. Very important because it really is the first documentation to confirm what we've always known, and that is that inflammation is the cornerstone of atherosclerotic disease. That's vascular disease that causes heart attacks and strokes. Any inflammation in the body predisposes to it. Conditions such as rheumatoid arthritis, which are inflammatory disease predisposed, but also lifestyle changes that we do, smoking, wrong foods, stress, they all increase inflammation. And so we've always known that relates to cardiovascular disease, but this study showed an actual reduction in events. And one important aspect of that study is that the patients were all on LDL, statin drug, reducing LDL levels, which is very important. But the LDL levels were not reduced further, and there was reduction in events. And we know that statin drugs reduce events by around 50%, but that leaves 50% with events. And inflammatory disease is a major component of that. So the fact that we can actually affect this disease by reducing inflammation is really a key information for us to be used in clinical practice.
Cankinumab, Cankinumab, as in boy, Cankinumab is the drug, and maybe something to ask your heart doctor about. Robert, when you were on the playground playing with your best friend Timmy, did you say, gosh, I want to grow up and be a prominent heart doctor? How does a guy become this?
No, I didn't come to that conclusion. Quick story, I was about 21 years old. I got tuberculosis, and they had medication for it then, which was fortunate because it used to be consumption and quite a deadly disease. But still, I was at a county hospital for 6 months because they isolated. But it changed my paradigm. I went from scholastic probation to want to be a doctor and became one. So
you got to be kidding me! Are you kidding me, Bob? That's an incredible story. So you almost died from tuberculosis in the hospital. 6 months. You were scholastic probation turned into this practicing cardiovascular disease doctor. This is America. Wow. God bless her. God bless her.
It was a tough way to do it, but it was a blessing in disguise.
Well, good for you. Thank you for your contributions and what you're doing to help save people, Bob. I appreciate your time.
Thank you.
Thank you.